I'm Nathan Friedman, the CEO of Hemasense, and we're a Arizona-based medical device startup. And we've developed a product that is used for patient monitoring following surgical procedures where a patient has had a catheter-based procedure. What we do is we have a wearable device that can detect bleeding below the surface of the skin before you would ever see it at skin level, so that patients who are in recovery can be monitored for these bleeds. Our first application is actually catheter-based procedures. And so what this means is in your femoral artery or vein, they'll place a catheter in there, snake that catheter up through the blood vessels to treat some sort of disease state like an insufficient heart valve or an aortic aneurysm or an ablation procedure or something like that. And in about 10% of those cases, after the catheter is removed and the patient's sent to recovery, they have a clinically relevant bleed that happens below the surface of the skin. And the key here is that this bleed doesn't happen at skin level, it happens at the level of the vessel. And so a lot of times if you have one of these bleeds, you're accumulating a lot of blood there before you would ever see it at skin level. Treatment for it is actually relatively straightforward. If you catch it early, it's direct pressure on that. So it's just like putting pressure on a cut on your hand or something like that. And in those cases, when you treat it early, the patient doesn't need a blood transfusion, they don't need secondary surgery. But when they don't catch it, patients could lose up to a liter and a half of blood into their leg. And at that point, they have to go in and get a secondary surgery. So the way that we actually do this, the way that we detect this blood below the surface of the skin is we have this electrode patch and we use a technology called bioimpedance, which means that we are measuring the conductivity of the tissue below where this patch is applied. So you can see in this demo that we have here, the patch is applied in kind of this groin region. These dots here represent where the skin puncture would be, where they put a needle in and then they put the catheter in at the skin level, and then this dot is about where the vessel puncture would be. So this surrounds the area but doesn't actually touch it, so you can still visually see what's going on there. And then we measure the conductivity of this tissue, so when blood starts accumulating, we see the resistance go way down or conductivity go way up, and that indicates that there's blood. We can detect down to probably 20 cc's of blood up to about 7 centimeters below the surface of the skin, enabling this to work on all these patients. So that's kind of the technology that we have. And right now we have completed initial animal trials on this, and we're in discussions for some early human trials coming in the beginning of 2026, with a goal of submitting to the FDA for approval at the end of 2026 and getting on the market soon thereafter.